Thank you so much for joining us for this session. My name is Eric Johnson. I am Senior Vice President of Commercial Development for J. Nipper and Company. During this session, we'll be discussing the impact of COVID-19 on sampling going forward. We asked 4,500 physicians how they were currently distributing samples by percentage of time. Next, we asked them if alternative options were available, which would they utilize and what percentage of time? The first question, during this COVID-19 pandemic, please indicate what percentage of time you distribute samples to patients through the following methods. Patient picks up at our office, we mail to the patient, an employee of the practice delivers to the patient, or we use a courier service to deliver to the patient. Next, we asked, during this COVID-19 pandemic, if alternate means were available to deliver samples to patients, please indicate what percentage of time you would utilize the following. The patient picking up at the office would be 46%. If samples came in prepaid envelopes, address them and mail them to the patient 25% of the time. An employee of the practice delivers to the patient 2% of the time. Coordinate with a courier service to deliver to the patient 2% of the time, and complete an order on the internet and have the sample shipped directly to the patient 25% of the time. Exploring alternative distribution. The FDA has stated they don't intend to object to the delivery of prescription drug samples by mail or common carrier directly to the identified patient's home during the public health emergency. So let's send the samples to the patient's home. Not so fast, as we know each state has specific regulations regarding who can distribute samples. We received an opinion from 5 states. 3 states outright said no to our request to send samples to their homes: New York, Alabama, and Kentucky. Arizona said we could ship directly to patients during the COVID-19 emergency, and California stated we could apply for a waiver of their rule. Therefore, any approach other than what has been implemented historically must be fully vetted to assure compliance not only at the federal, but also the state level. Thank you so much for joining us for this session. If you'd like to discuss more, feel free to contact us at nipper.com or by calling 1-888-NIPPER.